Good afternoon. My name is Jennifer Roeder. I'm a communications consultant for APFED, and I'll be moderating today's webinar about health journaling. Joining us today is Dr. Joshua Smyth. He is a health psychologist who studies how stress and daily experiences affect health and develops innovative, technology-based interventions to enhance well-being. Welcome.
Thank you. Thank you for having me, and thank you for those able to watch. So thank you again. As you heard, I'm Josh Smyth. I'm at Ohio State University. Um, I would like to start with some disclosures, which are not very major. I don't have any major conflicts of interest today. Much of the work I'm going to present has been supported by research grants, largely from the National Institutes of Health, also the National Science Foundation. Um, I also will mention one of our books, and I do have a small financial stake in the book. As you heard, I'm not going to make specific diagnostic or treatment recommendations today, but rather will be presenting you an overview of a broad medical and research domain. And last but not least, of course, my presentation today reflects my views and not necessarily those of my university or my funders. So, as you heard, I'm a psychologist by training, and I'm an academic by vocation. So I spend most of my time doing research in the fields of sort of health psychology and behavioral medicine. What that really means for me is that I'm a stress guy. I think a lot about psychological stress. And in the context of what I'll talk about in a moment as sort of mind-body associations. And so fundamentally, all of what I'm going to talk about comes from the perspective that our perception and appraisals of our world, our experiences, events, can impact our physical and mental health, and that largely this is mediated by the mood or stress or other immediate psychological representations we form in response to the appraisals and understanding of our environments. And that stress and mood in turn influences our physiology, our biological processes, our behavior, and other aspects of our lives that give rise to risk or resilience in terms of health outcomes or health processes. And so, as you heard, I generally spend much of my time examining the effects of stress on health and trying to develop and evaluate innovative interventions to promote health and well-being, sometimes through stress management, other times through other aspects. So, um, as mentioned, I'm sort of broadly really interested in this mind-body association. And if you're wondering who that fellow is, you certainly have heard of him. That's René Descartes. Um, and he did some really cool stuff, but he was also sort of a contributor in the context of a sort of cultural and political environment that led to what we now call Cartesian dualism, right? That the mind and body are separate and that we should keep them quite separate, and the mind therefore cannot and should not influence the body and vice versa. And I would argue that's actually fundamentally mischaracterizing both the evidence and sort of how we need to approach things. But that, from 1500s onwards has been sort of largely baked into our scientific as well as our medical environment. And in places where we talk about the connections between mind and body, or more broadly, the formal term is psychosomatics, it has to some degree taken on almost a pejorative implication, right? That it's not real, it's in your head, you're making something up. And I think that this is sort of has a legacy with a long tail that we're still struggling to get out from underneath. But in the last 20 or 30 years, I think we've come a long way. And a lot of that is a greater sophistication in our capacity to understand the biological systems that underlie health. And that notably is going to include our central nervous system, so our brain, how the brain functions, and our peripheral nervous system, right? How other processes in the body are controlled by descending outputs from the brain, right? So, and then into that, so when we start to unpack this, What we know, of course, is that the brain is very sensitive to outside inputs, and those include our perceptions and thoughts and feelings about what's happening to us or what has happened to us. And that in turn leads to changes in our physiology, our behavior, and other aspects. So we again can start to directly link our experiences and understanding of the world to behavior and physiological processes that can meaningfully influence bodily processes up to and including sort of the morbidity and mortality related to disease. So whether we get sick, how sick we get, whether we recover or not. In this perspective, we've been for many decades now really interested in whether we can utilize creative and expressive techniques. And I'm going to broadly sort of talk about that as arts and health. And so using these creative and expressive techniques to promote health. And we've done this in sort of two broad ways. One is we try to integrate the arts, broadly defined, into sort of both patient education and training, as well as medical provider education and training. And so this would be the idea that through arts we can develop skills or experiences or understanding or capabilities that will promote health and well-being, either in a patient struggling with a difficult disorder or diagnosis, for example, and in providers who may be caring for patients with whom they do not share a certain experience, whether that's a life experience or a disease diagnosis or what have you. We also have been developing and implementing and evaluating a variety of creative and expressive therapies to promote health and well-being, one of which I will be talking about today in some length. And so just to give you a sense of this, we have been looking at this idea that if we provide physicians with works of art broadly defined, and here you have a novel, you have a picture, you have a sheet of music, you have a graphic novel, and we and others have shown that if you present these materials and work with physician trainees or physicians or nursing staff and integrate that, they develop better clinical skills, better rapport, more empathy and compassion, uh, particularly in those domains that the art is expressing to them. And it allows them to gain sort of this more nuanced understanding of what's going on. And you might sort of think, oh, well, there's probably not much out there, or how do I find those things? And it turns out there's a lot, and it's really quite neat. And this is a somewhat arbitrary collection, but just representative in the sense that we were interested in characterizing the kinds of resources that patients or providers could access. And these are relative to a range of pulmonary disorders. And we have this segmented by the type of artistic modality. So you have books and poems and movies and music and painting. And this kind of information is really widely available across diagnostic categories or different modalities of creative and expressive thought. We also have worked really hard to take our more scientific, academic, research-related findings and find ways to get them out into practice and into the community. And one way that I've done this personally is through a longstanding collaboration with the Foundation for Arts and Healing, where we have done very strong empirically based or evidence-based work on evaluating the potential health benefits of creative and expressive arts. And then we've created and implemented a variety of community-based creative and expressive arts. And that has ranged from targeting children with chronic disease, particularly rare chronic diseases, to parents, to workers in high stress jobs, to healthcare providers. We often try to develop programs that are scalable and peer-led so that they're widely accessible and in an attempt to reduce some of the barriers to accessing helpful services. And then more recently, although it's not going to be the focus of what I'm talking about today, we have really leaned into trying to understand and remediate what we see as sort of a worldwide epidemic of loneliness and lack of social connection. And so we have a lot of approaches to try to reduce loneliness, which is more the psychological experience of loneliness, and promote social connection and social integration, which are more the behavioral or structural aspects of being isolated. And I'm happy to sort of talk about how that may relate to what I present today, but I think is really important because the evidence that we and others have produced suggests that in the act of sort of engaging in creative and expressive behaviors or programs, it is possible to form really strong bonds with other people. Okay. But let me turn to what I'm going to focus on today, which is broadly, what in a general sense is called health journaling. I'm going to sort of more narrowly talk about expressive writing, and this really reflects an effort to evaluate if sort of narratively focused, private, and I'll come back to what I mean by that, emotionally expressive writing can be beneficial, can be therapeutic in the promotion of health, well-being across a range of contexts and persons. Um, and this is just sort of a sample of some of our empirical work. On the bottom left, we had one of our first major papers was in the Journal of the American Medical Association, going on over 25 years ago now. And a more recent book, which I'll present again at the end, with my colleague James Pennebaker, that summarizes this work very broadly. So what we were very interested in is that people generally feel an urge, a desire, and perhaps even a need to share strongly emotional experiences, good and bad, and that particularly when we experience troubling, negative experiences and our responses to those experiences are persistent, we may use disclosure and discussion with other people to help sort of figure out what's going on, to try to get over something, to try to improve. And when that goes well, that is often a very helpful process. But what we were interested in was that it doesn't always go well. And so there may be topics that you are unwilling or unable to share with others. So something that you find embarrassing or shameful, or that you are unwilling or unable to sort of show that you are hurting, that you feel like you have to be the strong one. And so you don't want to reveal to other people your ongoing concerns. There may be stigma, again, either about the content of your experience or that people sort of subtly or not so subtly send non-supportive messages, sort of, you should be over this. I don't want to hear it. And in some cases, and we've seen this in the context of managing chronic illness, where initially at the time of a diagnosis or an acute event, people can be very supportive, people in your social network. But if the problem persists and people continue to talk about the struggles they're having, or their child is having, or their parent is having, with an illness or a problem of some sort, that level of sort of support can go away. People become less helpful. And over time, it may even elicit rejection, sort of stop talking about this, or people start avoiding you. And so that, of course, cycles back to the first, where you sort of learn that maybe I shouldn't share. Maybe I need to keep this to myself. And early work on this found that when people are struggling with sort of persistent negative emotional experiences and they don't feel able to share, they're at heightened risk for a whole variety of both medical as well as psychological poor outcomes. And so, we got very interested in thinking about, hey, could we give people the chance to disclose or share, but without requiring an audience, without requiring sort of the formal audience. And there were a couple of reasons for this, right? Why didn't we want an audience? Well, one um, was a lot of this sort of naturally occurring disclosure happens to other people, and these negative experiences or responses that I just mentioned can occur. Of course, one can go into formal psychotherapy, and if one can get access to high quality psychotherapy, that's a wonderful thing. But unfortunately, that's very difficult for many people. There may not be adequate clinical opportunity where they live. They may not have appropriate health care, particularly mental health care coverage. So the costs or burden are difficult. And so we were sort of really interested in what about if we just had people write, because people can do that. And we thought about just looking at people who write normally. And so back in the olden days, that was maybe writers or poets, or then it was people who kept a blog, and then it was Facebook, and now it's probably other modalities, and maybe some paralinguistic modalities like TikTok videos or something like that. But all of these are sort of naturalistic disclosure. The problem with studying that is that the people who are doing it and what they're doing it on, of course, is not at random, right? And so we have a difficult time understanding whether or not the content or the process is helpful or not. Now, I'll come back to what I mean by that in a moment. Um, but so we decided the way to sort of look about this was to do more sort of clinically relevant studies that followed the model of a randomized controlled trial. So, if we were testing a new drug for pain reduction, we would give people a pain pill or a placebo, and we would then be able to get a clearer, albeit not perfect, understanding of the causal influence. And so let me sort of unpack that a little bit. So if I tell you that folks who exercise are healthier, I don't think that would shock anybody. Um, is that a causal um, relationship? Well, it certainly could be, and intuitively, I think we might say, yeah, of course, exercise is good for you. I know that. But it is also the case that um, if I am ill, that may keep me from exercising, right? So we would call that a selection factor. So some of the reason people aren't exercising is because they're unwell already. And so we don't want to conflate that. And to give a sort of a more interesting, perhaps, example, people who take pain pills, NSAIDs or whatever, are in fact in more pain than those who are not. And we don't think that's causal, right? We don't think that if I take an aspirin, that's increasing my pain, right? Of course, that's going to be a selection process. I take it when I'm in pain. But if we're not looking at the timing or the nature of that, we're going to have to be careful about our causal inferencing. It's also the case that not everyone takes aspirin at the same time, or they use different drugs, or they take different amounts. And so again, we get into these complicating factors. And so the best way to unpack all of this is through some sort of design where we're able to experimentally assign people to do something or not do that thing, where all other factors are ideally held constant or made equivalent. And so when we started thinking about how do we figure out if asking people to write about their negative emotional experiences is helpful, we decided we were going to do this in a clinical laboratory setting and have people come in and randomly assign them. And we would randomly assign half the people who came in to write about emotional events. And early on, as you'll see, that was generally focusing on really stressful and traumatic negative experiences. Or we would randomly assign them in the same context for the same amount of time to write about emotionally neutral topics. And so we might say, um, describe the contents of your closet. So it is intellectually engaging. There's lots to talk about, but it is emotionally quite neutral for most of us, unless we have really problem relationship with our closets. In the early days, we did this for 3 consecutive days for 20 minutes each session. Again, that was somewhat arbitrary, and I'll come back to this sort of how much and how often question a bit later. But we did quite explicitly focus on having people write anonymously, not public writing. And again, because of the sort of the stigma and the preemptive evaluation that people make about responses, what we found is that if people are writing publicly, so they are writing something that they're going to share with someone else or post it online, they write very differently. And they're writing in the context of impression management. They are writing to elicit a certain response or to avoid certain negative responses. And we found that that really impeded what we are hoping to engage in this sort of more therapeutic writing. And so we really emphasized that this was writing for yourself only and was going to be anonymous and not shared with other people. So what did we actually ask people to do? In our first couple studies, we asked people to write about the most stressful or upsetting experiences of your entire life. You can write on different topics over the 3 days or just one, but it's really important to write about your deepest thoughts and feelings. You can write about any topic again, but it should be something that has affected you. You have to let yourself go. You really have to touch those deepest emotions and thoughts. You might find it upsetting and you feel depressed, and that's okay. So what you see here is that we are clearly focusing on negative experiences, and it reflects our sort of starting perception that some sort of unresolved negative feeling, ongoing stress or trauma or dysphoria was at the root of this, and that by delving into this really, really, really deeply, that people would start to feel better. So did it work? Was there evidence that this was helpful? It turns out yes. There's going to be a but coming soon. But broadly speaking, yeah, we found a lot of evidence that when we did this and we compared these two groups, so again, we're now comparing individuals who are all brought in and then were randomly assigned to either do this expressive writing task for 3 days, 20 minutes a day, versus those who wrote about emotionally neutral topics, such as describing the contents of their closet. And then we would look a month or 2 months or 3 months later on some outcomes. Sometimes those were self-report outcomes. So how are you feeling, your depression, your mood, your stress? Sometimes they were objectively measured. So this might be some sort of assessment or task or biomarker. We did see improvements broadly, and interestingly, those improvements were not just on things people were telling us. So they were not just on self-report, but rather included sort of biological outcomes, as well as objectively measured indicators, such as, um, in one study, we brought people in who were unemployed and looking for work, and we randomly assigned them to do expressive writing or not. So this is not a health relevant outcome, because what we were looking at here was the probability that they had gotten another job within 2 months. And we found that a much higher proportion of people were able to find a job uh, in the expressive writing group than those who did the emotionally neutral writing. And that's sort of really fascinating, right? Because this is an objective outcome that seems unrelated to stress or trauma. And we were not able to characterize all of the processes with with great granularity, but it seems that people were emotionally more settled, were able to engage with the interview process and the job search process more effectively following the expressive writing. So it started to give us hints about, we were able to sort of enhance their self-regulatory capabilities, particularly emotionally and behaviorally, and that led to some longer-term success. I also want to point out that, not just our work, but this was being picked up across the world. And so these kinds of studies were done in other cultures. So, cultures that were more individualistic versus collectivist, or different values on expressive uh, disclosure, different values about whether you express or restrain expression of negative emotions. In particular, it was not only done in English, it was done with people who did not have high levels of formal education or were not particularly fluent in writing. And so, those were things that we were worried about early on would represent real barriers to this, that if you had to be well educated and very comfortable writing, um, that would limit the potential scope of what we were finding. And we did not see that. As a reminder, this was quite some time ago. So this work was happening in the 1990s and early 2000s. And of course, we had computers there, and it was a little bit before the advent of smartphones. And I say that because all of this early work was done with literally writing by hand, which seems so quaint and antiquated now. But that was how we did the early work. I will give you a spoiler alert that unsurprisingly, a lot of the work now is on computers or on smartphones or in other domains. And we can come back and talk about whether that's helpful or harmful in terms of the processes. Although there were a number of these studies, there are formal mechanisms, systematic reviews, meta-analyses, these sorts of things to evaluate benefit. I conducted one of these quite some time ago, and that synthetic or cumulative review suggested that across all the available evidence, there was a pretty clear signal that expressive writing was related to better outcomes across a variety of domains of outcomes, again, self-reported, behavioral, sort of psychological, and then physiological, relative to emotionally neutral writing. There were a couple of other things that were important. And one is that all of those early studies, so the first, 5 or 10 years of work, were using study participants who were physically healthy. And the other thing we found was, as we suspected, people asked to write about their more stressful and upsetting experiences did get upset. That was emotionally challenging for them. But the degree to which they got upset was not related to the degree of benefit they experienced. And so, if you went to the gym in the 80s, you remember, no pain, no gain, right? That this idea that you have to suffer to improve. And we thought that might be the case, but we found no evidence for that early on. It was that delving into emotionally difficult topics is difficult, but it is not part and parcel of the process of improvement. I'll come back to that because it did allow the possibility that there was still some minimal level of negativity or a threshold effect, but even that perhaps is not the case any longer. So about this time, we shifted gears a little bit. In my work in particular, I said, can we look at this in ways that matter a little bit more? And to me, that meant two things. This approach of asking people to write emotionally about strongly felt negative or other experiences had the potential for really wide reach. There's no cost associated with it. You just pull out a pen and paper or whatever method. You can do it at your own time, at your own availability. And so again, you can sort of access this as a potential therapeutic approach with no cost or barriers. It also, as long as it's done privately, circumvents the need for and potential negative responses of disclosing interpersonally or in a social context. And again, I think if you can disclose psychotherapeutically to a trained therapist or non-trained, but to supportive friends or family or whatever, that's wonderful. Again, I'm not suggesting that that is an unhelpful process. I think that is wonderfully helpful much of the time. It's just that what we are concerned about is that many people do not have that opportunity. They either rightly or anticipate that individuals may not be willing or able to provide a supportive ear. And so this gives an opportunity. And so the clinical relevance that I was interested in were either or both. Can we try this in persons who have ongoing medical conditions? And my thinking there was if I have a chronic illness, a chronic disease, that requires ongoing maintenance. And we know through a broader mind body, in particular, sort of the impact of stress and mood, that when I enter periods of persistent stress or negative mood, that can exacerbate an existing condition. I may have a flare, my symptoms may get worse. It may impede my self-care activities or behaviors. And so there was a need for this in ways that struck me as really valuable. Or can we think about outcomes that are more relevant? So it's wonderful to sort of have a change on a self-report scale in a healthy person, but what about looking at, depression in people who are actually at risk for major depressive episodes or who may be, at risk for some other outcome? And so we have conducted many, many, many studies on this now, and just really sort of a whirlwind of them are listed here. Um, we tested expressive writing versus emotionally neutral writing in patients with asthma, and we saw clear and dramatic improvements in lung function as assessed through spirometry. And so we saw primarily improvements in forced expiratory volume in 1 second, which is sort of, the gold standard of primary airway function in asthma, and that these improvements were of clinically relevant magnitude. And so they represented a substantial increase over baseline, and that this increase was maintained up through 3 months following the expressive writing. So even after the patients were done writing, their lung function was still better several months later. Similarly, we found improvements in pain, stiffness, and range of motion in the primary affected joints in patients with rheumatoid arthritis. And that was primarily in the hands and joint features of the hand. And here we again saw that the improvements were clinically relevant. And so persisted also several months after the expressive writing was concluded. We recruited patients who were in remission of a primary diagnosis of cancer. And this was a heterogeneous group of cancer patients, so not a particular cancer type, although all of them in this study were solid tumor cancers. And these, again, were patients in remission. And so they were not currently, they had finished all treatment. They were not currently undergoing cancer-related treatment, but we conducted expressive writing versus emotionally neutral writing with these cancer patients. And we found that they exhibited several months later lower depression symptoms and anxiety symptoms if they completed expressive writing relative to emotionally neutral writing. Similarly, we did an online trial. And so this study was one of our first where we said, what if we don't do this in person? What if we don't do it with handwriting on paper, but rather created a web portal where people logged on and so they could do this at a distance, so still on demand, still private, but rather than unstructured expressive writing, we decided we needed to give them some structure. And part of the reason for this was, as you've heard me say a few times, the uh, the nature of the writing was quite negative, and we were nervous, I think, cautious and nervous about doing that where we couldn't see the people. You know, when we're doing this in a clinical office, we see the patients, and so we can make evaluations if anyone seems like they're in distress or at risk. But moving it online, we got quite nervous. So we made a fundamental shift here and we asked them to potentially include negative aspects of their experiences, but to really focus more on positive aspects of their experience. So we asked them to focus on the benefits they've experienced from things they've gone through, or gratitude exercises, a number of what we broadly referred to as positive affect journaling. So here we've completely inverted the content of writing. And now we're asking people to do expressive writing in sort of a similar way, but are now comparing, asking these sort of general medical patients recruited through primary care to write about positive aspects or write about things that should make them feel more positively and comparing that to emotionally neutral writing. And here we saw reduced psychological distress and enhanced well-being at several time points after writing. There was some inconsistency there, and I will say the effects were not as pronounced. They were not as clear or as dramatic as some of the more negatively focused writing, but nonetheless, there were systematic improvements observed. We also have in our in-person studies often collected biomarkers, whether it's a blood draw or saliva draw or other things, to try to understand biological changes. And that, as you no doubt expect, is a little bit more complex, and there are a lot of things to look at. But broadly synthesizing, what we found there is that in individuals who complete these expressive writing exercises relative to those doing the emotional neutral writing, that there are sort of quote unquote improvements in biological indicators. And so most consistent among those, in my view, are that we see reductions in stress-related hormones, notably glucocorticoids or cortisol in humans, and that we see some indication of reduced pro-inflammatory processes that can sometimes be specific. So we might look at IL-2 or IL-5 or IL-6, for instance, but it can also be more generic where we get some indicator of sort of systemic pro-inflammatory processes like C-reactive protein and show that that decreases following expressive writing. And so this again gives us a hint at how the stress and affective changes may be filtering out through our biological systems in ways that can reduce symptoms or promote well-being, particularly in some of these more inflammatory or autoimmune related diseases that we had studied at that time. So I'm going to horribly mischaracterize a quote by Rudyard Kipling. This is not really how he was talking about them, but sort of, you know, what we essentially are arguing is that, you know, writing is not merely expressive as in a window into what you're feeling, but that it actually exerts a causal influence, and that, you know, this sort of creative expression through written narrative can help us get better. And we can almost think about this as a drug that's not a drug, right? This is a psychotherapeutic exercise, and that we have evaluated it in the context of randomized controlled trials with an attention and time match control in the manner of sort of drug development. Great. So you're going to say, "Good, this sounds awesome. Can I do it? Let me go." Uh, yes, you should. I want to say there have been now many hundreds of studies, quite literally 300 or 400 published studies, and they're not all positive. There are, in fact, many studies that do not show clear benefit of expressive writing. Um, I will say, and we have reviewed these studies quite formally, and many of them are not of high quality. So the level of evidence or the level of sort of the design features of the study are not very strong. And so we have to take those with a grain of salt. The other aspect of it is a lot of studies were sort of testing new things, as we did. We shifted from negative writing to positive writing. Does that work? What if I write about the future instead of the past? What if I write from a third person perspective instead of first person perspective? And those are all great, interesting studies academically, but if they don't work, does it mean that the broad domain of expressive writing is not effective, or rather is it saying that this particular way of doing it may be less effective, or at least less effective in the context within which it was evaluated? So I think that we also have to keep that in mind. So I would just say, look, this is not a panacea. This does not cure everything perfectly, and I guarantee this is going to help. However, I also would say there is very clear evidence that there's almost no risk. There are no side effects. If you are writing about something that is deeply traumatic and troubling that you cannot manage on your own, delving into it in the absence of other supports may be ill-advised. And so I would say be cautious in that context. But most of the things that people are going to write about are going to be things that you're already thinking and feeling and dealing with in everyday life. And so it's really not going to create any additional risk. There is a lot of variability, and the sort of fancy term we use for that is treatment response heterogeneity. So who benefits and why? And so we've spent a lot of time trying to figure that out. What are the factors related to outcomes improving? Who benefits, who doesn't? What are the mechanisms that will help people benefit? And so I want to address the sort of, the big question, which is how does writing work? And the short answer is I don't know. Um, don't worry, there's a long answer coming. But in the spirit of disclosure, it turns out to be really complicated, and we don't have a clear understanding that I can package nicely for you. There are two things that we learned, though, that are quite clear. One is that, we initially sort of thought about how can 3 20-minute sessions do anything? That's such a little amount of time. And it's very clear that the intervention process is not constrained solely to those writing sessions. The writing sessions are prompting additional insight, reflection, thought, rumination, other disclosures, behavior change processes that occur outside of those sessions and persist over time. So it's not uh, like the writing just disappears as soon as it's over. The other thing it's not is sort of simple disinhibition, that I finally got this off my chest, or catharsis, I just need to get it out. And we've tested this in a whole variety of ways, and it appears that those are not how it's beneficial. And you can test this by allowing catharsis and other mechanisms, or talking about something you already regularly talk about, writing about something that you already regularly talk about. So it can't be disinhibition. And we still see expressive writing outperforming emotionally neutral writing. So what's the long answer? as I said, the process of writing seems to kickstart lots of stuff. And some of that is emotional clarity. So a better understanding, labeling, and acknowledging experiences. There are aspects of becoming less emotionally reactive, and so we might think of that as emotional habituation. The cognitive and sort of coherence of our neural and cognitive representation, so the way we think about it and actually the way it's encoded in our brain becomes more complex. We see other changes in brain activation. So when we think about these topics, and we've had people think about these topics in the brain scanner, and then have them do expressive writing, and then put them back in the brain scanner and think about those things, the brain reacts differently the second time if you've done expressive writing. And notably, the sort of physical symptom, bodily sensation, and emotion aspects of brain representation are lower after expressive writing. So again, the you can think of this as sort of the experiences are less hot, they're less arousing. We see reduced rumination and intrusions about these topics. We see increases in self-efficacy and mastery. We see better goal setting, improved cognitive function, improved sleep, better social interactions. I mentioned physiology, so we see normalization of stress-related physiology and inflammation. There are many others, believe it or not. But the idea here is that we are kickstarting a whole host of processes that are all interrelated. And it's probably the benefit emerges from a complex interaction of what are dynamic and recursive processes amongst these, right? So if I sleep a little better, my mood's a little better, and then I'm able to do something else a little better, and then I sleep better because I'm less stressed. And these things are feeding back into one another. This is the difficulty in clearly characterize them, right? People are complex animals, and it's just really hard to disentangle all of these both behavioral, physiological, and psychological processes. To throw another curveball, it also may be that the specific aspects that are changed may not be the same for everybody. So maybe if I do it, most of my benefit is from mood and rumination, but for someone else, it may be physiology and sleep. And so again, we have to figure out what these relationships are. We've sort of talked about this more broadly as what I colloquially call stinking thinking. And that is that we know that persistent psychological stress and dysphoria is a huge risk factor for healthy people, but even more so for individuals manning a chronic or persistent condition. And partly this is because when we're dealing with stressors or stressful things happening in our life, they're rarely truly persistent, right? Even something that goes on, a poor relationship, managing a chronic disease, having a lousy job, those are persistent in a macro sense, but on a day-to-day or moment-to-moment basis, I don't necessarily experience negativity all the time, but I do worry about it. I anticipate them. I ruminate about them. And we have shown, and others have shown, that this dramatically changes the underlying physiology of a person so that they exist in what we refer to as sort of a physiologically hypervigilant state. They're on guard, they're aroused, they have persistent fight or flight. And most modern stress theories now explicitly talk about this. And our work and others has shown that this actually is a common pathway that predicts people's responses to poor stressors. So when I go through something negative, the more I think about it and worry about it and experience negative emotions associated with the topic, the more likely I am to experience negative health outcomes. And so expressive writing, we argue, disrupts these processes. So can you use this for yourself, for another, for a loved one? Can you recommend it to others? I would say absolutely yes. As I mentioned, the primary motivating factor in this work is it's accessible, it's easy, It's doable on your own. So go do it. We liken this to preventive maintenance rather than major home repairs, right? So, can you fix some things around your house before they get too bad? Absolutely, right? If, half your house falls down, most of us are not capable any longer of fixing those problems. And we think that sort of psychologically and biologically, expressive writing works the same way. And to put that into cleaner, clearer language, um, when you are seriously impaired biologically or psychologically, expressive writing no longer seems to be very beneficial. It passes a sort of a limit of where we think this can be helpful. And so, as an example, we've tried expressive writing in patients with advanced lung disease that were intubated. And I thought for sure this was going to be great because they're isolated, they're bored, they're lonely, they're worried, they're scared. We were not able to find any way that we could use this to help them. And ultimately, we believe it was because biologically their disease was so advanced, it was non-responsive to the kinds of changes that we were able to produce. We've seen this in other contexts where there's a lot of uncertainty and future-oriented concerns related to the presenting condition. So people who are in sort of complicated bereavement, so they've lost a spouse, often in unanticipated or negative ways, or in highly conflictual divorce. Again, we thought these would be good contexts to help, but psychologically, it seems like people are really not able to benefit in those extreme cases. But for most contexts, when people are generally doing okay, we see a very clear signal that expressive writing can be beneficial. Do you have to write about negative stuff? No. As we mentioned, we switched to positive stuff and it worked just fine. You can write about the past, you can write about the present, you can write about the future. Although the one thing we have found is less helpful is writing about an uncertain future. So, really speculating on a variety of bad things that could happen in the future does not appear to be helpful. So, other than that, I think the topic is pretty good. How often? Where do I write? How do I write? Should I write about something specific or general? And here again, there is a lot of evidence that for any given person, different things can be beneficial. And so what we encourage is self-experimentation. Try different things. Try writing frequently. And if that doesn't feel right, space it out. Try writing for brief 10 or 15-minute sessions to start. If you feel that's too long, go shorter. If you feel like you need more, go longer. Try writing about a mix of things. Write about broad topics in your life and then maybe specific challenges or opportunities you're facing and see what grabs you. It is absolutely okay to adapt this for yourself and further to adapt it over time. So how this starts out for you may work really well in a structured episodic way. 15 minutes once a week, every week. But that may change over time. And there may be periods you want to write more frequently. There may be periods where you go long times without writing. That's okay. There is no specific rules or guidelines that you must adhere to. So that might be overwhelming. There are some good resources to start with. Again, conflict of interest alert. Our book, Jamie and I wrote a book widely available on Amazon, highly discounted at this point, that you could pick up. The first book here by us, I would characterize in the learn more category. So it's got some instructions and structure about how to write for yourself, but it's really much more about the evidence and nature and mechanisms and sort of goes into the kinds of things I talked about today in even more detail, although in a non-jargony, non-scientific sort of way. The second book is sort of the doing book, and I'd recommend that one. I have nothing to do with that book. And that has, again, some of the evidence and some of the logic and rationale, but really has a lot more structure and it gives you example schedules and writing prompts and really can get you going um, in ways that are a little bit more guided than than the pure self-experimentation that I advocated a moment ago. And last is a recent book that I found really interesting. It is not about expressive writing per se, but it's about things you can read to get you inspired for topics or approaches or ways of writing that might have you get a little bit more creative and to sort of get you out of your comfort zone in ways to think and write about emotional experiences that you may have had in your life. So again, all good places to start if you want to get this integrated into yours or another person's daily life. I'm going to stop there. I think we have a little bit of time for questions and answer, and I appreciate your attention throughout this talk.
Well, thank you so much for all the history and the suggestions and different ways that this can help impact people. So if for those of you joining us live, please go ahead and open the Q&A tool within Zoom and go ahead and submit your question. We've got a few minutes left here that we're going to have kind of a bit of a discussion. Alrighty. So for someone who might be new to health journeying, what would you say is the best way to get started?
I think I would start with simple, and I would start with some structure. And so if someone is able and capable of writing by hand, old-fashioned yellow lined paper and a pencil or a pen, I think is good. But if you want to use, a computer or even have to use a voice recorder, that is okay. I would find a quiet, private place where you won't be interrupted. Um, that could be in public and conceptually, you could be in a cafe or something if you're writing, maybe not speaking out loud so much, um, but you want to be able to focus on this. And as to the topics, I think the important thing is to focus on writing about important aspects of your experience that you know you have strong emotional reactions to. If you're comfortable and find it helpful, you can focus on negative or challenging experiences. But if that's not something you're comfortable doing, I think focusing on sources of strength, opportunity, and resilience can also be really, really powerful. And again, that may change over time. So I would encourage repeating this process several times. And at some point on a given topic, you'll be like, kind of done with this one. And then you shift. And that could be a shift in topic or even a shift in focus from positive to negative or vice versa, or past to future oriented, something along those lines.
So here's another question for you. I often start journaling, but lose motivation after a week or two. What tips do you have for staying consistent?
Yeah, it's a great question. And we've been really curious about this too, about, what do people do naturalistically if you just sort of keep a journal? And it turns out, oversimplifying a great deal, there are kind of two kinds of journal keepers. One is the very methodical journal keeper. You have a schedule, once a week, once a day, you go in and you write, and it tends to be more documentarian in nature, right? So it documents things that are happening. Obviously, it focuses on more big stuff than little stuff, but it's very regimented. Um, there's a different kind of journalist who writes in a journal when things are big. So they could go weeks or months without saying anything, but then they might write every day for 2 weeks because there is a big event, positive or negative. I'm getting married, or I just had the birth of my grandchild, or whatever it is. But it creates a sense of effusiveness, emotional effusiveness, positive or negative, and this is a way to manage it. So I think the first step is to make sure you're doing the right one. And if you're trying to do it in a regimented way and that doesn't feel right, you might be the other one. And so then I would say start by having a system, a regular system of documenting your need and interest. So do I have things I want to journal about? And you might not. And to me, that suggests you're not documenting only, that you really are finding that helpful when you're dealing with the emotional aspects. And so then you might have a check-in weekly or monthly and say, do I need to do this? And then do it until that need is met. And then don't feel obligated to do it until the need is recurrent.
Do you ever find that there's a way to use health journals to help communicate information to healthcare providers?
Yeah, this is that's a very good question, and we're really interested in how to capture sort of the lived experience of a patient and then use that information clinically, whether you are getting it to a provider or not. As I've noted several times, if we ask people to write for their provider, what we get is not useful. It also, of course, allows one to try to document and perhaps gain greater insight into the causes and consequences of an illness. So, what are my triggers? What are the places in my life that I'm making accommodations, importantly, behaviorally, psychologically, emotionally? What am I feeling in response to this? I'm having to skip out on certain events, or I can't go out to eat with certain people. And so I'm missing that. And those insights, I think, can be conveyed because then they can become part of an action plan for how to manage that. I will say that not all providers are equally comfortable and skilled with integrating and responding to that information, but certainly you can try it. And you may also find that actually doing it yourself, um, certainly if there are specific triggers that you're able to identify, and particularly if they're non-behavioral triggers, right? We might be pretty good at food diaries and tracking that and getting to sort of, although that's super complicated, as your audience knows well. But that's maybe more observable. It's much more difficult to do that with emotional or behavioral inputs. And so, you could generate insights there that you could use yourself or convey to your provider as well.
Well, thank you so much for all the information that you shared today and for the extra time that you stayed to be able to answer people's questions. We really appreciate it.
My pleasure. Thank you very much for having me.
Thank you again to Dr. Smyth for your insights today. And thank you also to our education partners for their support of this webinar series, including AstraZeneca, Bristol Myers Squibb, GSK, Sanofi, Regeneron, and Takeda. Our next webinar will be about eosinophilic fasciitis featuring Dr. Catherine Sims. On October 21st, she will discuss diagnosis, challenges, and care for this condition. You can register at apfed.org/webinars. You can also continue learning more about eosinophil-associated diseases by subscribing and listening to our podcast, Real Talk Eosinophilic Diseases. In the latest episode, we talked with Dr. Anna Henderson about bone mineral density in pediatric eosinophilic esophagitis. You can find the episode at apfed.org/podcast, as well as on Apple Podcasts, Spotify, Audible, and more. We also encourage you to check out the on-demand recordings from our annual patient education conference. Visit apfed.org/conference, and you can register for free to watch all those sessions through the end of the year. Finally, we encourage you to continue the discussion started today in our online community on the Inspire Network. It's a great place to connect with patients and caregivers for support. Check it out at apfed.org/connections. Thank you again for joining us today for APFED's EOS Support webinar series. If you have a question that did not get answered, please email mail@apfed.org. Have a great afternoon.